Coronary artery disease is the #1 killer in the Western world. With advancements in improved imaging, physicians are now able to view the coronary arteries in more detail, which can prompt earlier intervention and increase survival rates. We spoke with cardiologist Dr. Victor-Kubbeh from Desert Regional Medical Center in Palm Springs, who describes the 64-slice CT.
Initial scanners were not sophisticated enough to get the heart as an organ, especially the coronary arteries. The cardiac CT as a scanner was incapable of taking those images because the coronaries, A, were small and B, were moving fast. So with the advancement of technology, the new scanners can now be fast enough and have resolution enough to be able to image those structures, the coronary arteries. Now, when we talk about 64 slice, we're talking about how many slices and how small those slices are in order to capture those small structures. We have the scanner, the new 64 slice CT scanner. Another way of referring to it is multi-detector CT scanner. We have it in the X-ray department, but we share it with the radiologists, so it's a radiological procedure. We have a team comprised of a CT technician. We have a nurse to administer the medications, because we do give some patients some medications sometime when they are under the scanner to slow down their heart rate. Basically, a physician is usually there to confirm that the EKG is in proper stance to perform the test. When I look at a coronary artery scan, I see thin slices of the whole heart, not only of the coronaries, of the whole heart. They are thin slices that cut through the heart like a salami, from the base of the heart all the way to the apex of the heart, and I select out what structures do I want to study. I'm looking for deposition of calcium, which is an indicative sign of atherosclerosis, and I look for constriction of the lumen, and I look for plaques that build up in the walls of the artery. And I look at all the arteries and from all different positions. Most of the time, they are patients who have chest pain that go to the patient. They are concerned about their heart, and the physician is not sure whether this is from a symptom coming from the heart or not, or is this a sign of coronary artery disease or not. So they usually send them to the cardiologist to have testing. In the past, it used to be a stress test. In the past, it used to be sometimes right away to the coronary arteriography. But now we have this test. The test's major strength is that if it is normal, you are sure it's normal to the degree of 95% that it is normal. So the strength of this test, if it is a negative test, if it is positive, you may have false positive results. But if it is negative, you are sure there is no abnormality. You don't need any further testing to confirm that. Other tests don't have that capacity.